Hello, my name is Dr. Komnoshi. I'm GP at King's North Medical Practice, Ashford. In this series, we will talk about common health conditions that could be treated at home without the need to call for the doctors. Cough is one of the most common symptoms that we encounter in consultations. Common cold and flu are viral upper respiratory tract infections that can cause blocked nose, sneezing, coughing, sore throat, temperatures, headaches and muscle pains. An average adult can expect 2 to 4 colds in a year, whilst a nursery-age child can have up to 12 a year, which last for 2 weeks each, so it sounds that they are ill all the time. They will grow out of it once they go to school. Most people know how to treat these illnesses by taking rest and fluids and use over-the-counter medication to ease the symptoms. However, there are a few things that are called red flags that could be signs of complications or more serious disease with cough, and you need to see your doctor promptly if you have any of these. So the red flags for cough are shortness of breath. It doesn't count if you are short of breath when you cough, but if you are short of breath at rest or when you exert yourself like going upstairs, then it's better for you to be seen by a healthcare professional. When you cough up blood, especially if it's not just a few specks of blood mixed with the mucus, but red fresh blood or clots, you definitely need to be seen urgently. Any fever higher than 38.5 degrees, lasting for longer than 5 days, need to be investigated. If you have chest pain on one side, especially if it's worse on deep breathing, it could be a sign of a chest infection or a blood clot inside your lungs. If you have underlying illness like asthma, COPD, weak immune system, or if you are frail or elderly, you're more prone to develop complications from an upper respiratory tract infection, so it's best to be seen. Any cough that lasts for longer than 6 weeks needs to be investigated. There are some common myths that we GPs still come across in consultation. Let's disperse them. I need to take paracetamol and ibuprofen if you have a respiratory tract infection with fever. This is not true. Mums often call us in panic saying that their child is refusing to take Calpol and Nurofen and they can't bring the temperature down. Well, if we know that the infection is a simple upper respiratory tract infection and there are no red flags, it doesn't matter how high the temperature is or whether it comes down with Calpol or not, then the child will just recover on their own, regardless whether they take paracetamol or Nurofen or not. These are just for symptom relief, so the child will feel less poorly if they take them, but if they refuse, that's fine, you don't need to force them. Myth number 2, cough and flu last for only a couple of days. We receive calls from patients saying that they recovered from the initial temperature and they are not in bed all day, but after 5, 7 or 10 days they still have the cough and they can't get rid of that, and it bothers them at night and they want something to be done. I can't blame them because cough can be very disturbing. However, it takes sometimes up to 3 weeks for the lining to recover after a respiratory tract infection. If it lasts for longer than 6 weeks, as we discussed, you need to be seen. Otherwise, it's okay to wait for it to dissolve. Myth number 3. Coughing up green mucus is a sign of a bacterial infection. You might start with a dry cough and then it turns to a more phlegmy, chesty cough with different colors of sputum. However, if there's no COPD, like chronic lung disease, at the background, the color of the mucus is not an indication of the origin of the infection, whether it's bacterial or viral. Viral infection can give you any colors of mucus, including green. Antibiotics are not the let's try anyway or I want to get better quicker, or I need to go back to work type of medicines that we used to look at them. Antibiotics are life-saving, precious medication that need to be used with the correct indication only for bacterial infections. Otherwise, if we use them nilly-willy, we will lose them very soon. Myth number 4. With cold and flu, I need to take cough medicine. Cough medicine for younger children contain no active ingredients. Most of the time they are sugary syrups or sweetened syrups with glycerol, which is a moisturizer that can help to ease the tickly cough in the throat. However, a lot of the time the cough comes from a deeper level of the throat, so the medicine only works for a few minutes or not at all. You might want to try it. If it works, that's fine, you can continue. If it doesn't work, you can just stop. Cough medicines for older children and adults might contain cough suppressants, and they are marketed for dry cough. It can be used with correct indication to ease the symptoms. However, if the cough turns chesty and mucousy, you need to stop these medicines, because you just want the mucus to come up to clear out, and the cough is a protective mechanism of the airways, is there for a reason. It's protecting your lungs from a more serious infection. Myth number 5. Using ibuprofen is better than paracetamol because it's an anti-inflammatory. Indeed, it is an anti-inflammatory. However, at the dose recommended on the over-the-counter boxes, it doesn't have much anti-inflammatory properties, and there's no evidence that ibuprofen works better for temperature or symptoms of respiratory tract infection than paracetamol. However, some people might find one or the other more useful for them. Myth number 6. Steam inhalation shortens the disease. Well, I would love to say that this is the case, because this is a common advice you hear from us GPs. Unfortunately, there's no evidence that steam inhalation shortens the disease duration. However, it might give you symptom relief temporarily. Myth number 7. My throat is so sore that I surely need antibiotics. Sore throat, again, is a very disturbing symptom. I can't blame you that you want to get rid of it. And if it's a bacterial throat infection, antibiotics can work quickly within 1 to 2 days, and you get better very quickly. However, in the vast majority of cases, these cough and sore throat type infections are viral diseases, and antibiotics won't work. Even if it feels like razor blades, it can be just a simple viral disease. If you're interested in tonsillitis and bacterial throat infection, please check out on our tonsillitis chapter. Myth number 8. If it spreads to the chest, I will surely need antibiotics. Yes, it can happen that the virus spreads to the chest, causing inflammation of the lining of the lower airways, called bronchi, giving you bronchitis. The bronchitis cough tends to give you pain in the middle of the chest that can be very uncomfortable, and the bronchitis normally lasts longer than a simple cold. However, most of the time it is the very same virus that have given you the cough and the cold, and antibiotics still would not work. There is a separate chapter on chest infections. If you feel that you might have chest infection, please check that one out. I hope that you have found this information useful, and it will help you to decide whether you need to see the doctor or you would be okay to stay at home and recover without medical intervention. I hope you will get better soon. See you next time. Bye.